In 1985, I discovered I had testicular cancer. And in those days, I was very fortunate because they had just recently perfected a surgery for it. Previously, may not have survived it, so I was very lucky. I'm involved in the Plant Medicine Expo and Healthcare Provider Conference because I've learned through personal experience and from healthcare professionals that there are many things that occur in nature that are readily accessible, that aren't exorbitantly expensive, that can really help people on a long-term basis without side effects. Marijuana being the most prominent of them all, but there's a multitude of them, and that just happens to have so many different uses. But the idea that it can alleviate suffering from cancer in children alone should be a call to arms. We're not really interested in so-called stoners. I mean, people can do whatever they want recreationally. This is a place for serious professionals, patients, family members, doctors, nurses, healthcare providers to come in a very, if I may say, classy adult environment that will educate them in a way that is really responsible and really on a very high level, not to be patronizing, but we're very serious about this. And I think the atmosphere will lend itself to the credibility, the intelligence, and the tremendous amount of research and passion behind this among those all involved. What I've learned from personal experience and from many friends and family is the simplicity involved in a doctor acknowledging the fact that this thing that occurs naturally in various forms can help suffering in children and adults. It's not a party drug in this form. And believe me, I know firsthand, and I know people who use medical marijuana because they have cancer or they have epilepsy or any multitude of diseases or the ramifications of treatment of those diseases. And to see the suffering alleviated, I don't think it's a political issue. I think it's an issue of compassion and emotional reality and support for people who are suffering. Whether you use marijuana or not as a social issue is incredibly irrelevant. It's a medical issue. It's a compassion issue. And I'm really very serious about educating people about it and hoping people will learn that the number one thing of humanity is to alleviate suffering in those that really don't have the knowledge or the wherewithal, including doctors. I think many doctors know a lot about it, but they're reticent for cultural and social reasons. And fortunately, more and more doctors are prescribing it for a multitude of things. So I think that patients can educate their doctors without insulting them. And the more people that talk about it, the more doctors will hear about it. And I think it's just a matter of time before more and more in the medical community will lift the stigma on it and use it for what it is, an incredibly miraculous curative force. Well, my closest friend is Jerry Lewis, who had a multitude of back, lung, and various problems in which he had been and can be in incredible pain. Among the things he was prescribed was Marinol, which is, as you know, a tablet form of the basic molecules in marijuana. And that's one of the few things that relieves his pain. And I can assure you that to give that medication to someone who is creative and helps other people is also another reason to use it.